Imagine feeling a sudden burn every time you pee. Or that uncomfortable urge that keeps coming back, even when there's almost nothing left to pass. For some people, it starts mild. For others, it comes like a wave, sharp, annoying, and hard to ignore. And often, it's all pointing to one thing: a urinary tract infection. Today, we'll gently uncover what a UTI really is, why it happens, and how you can protect yourself before the infection becomes something serious. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, Medicine Specialist, Diabetes and Hormone Specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, don't forget to subscribe to this channel for more simple, science-based, doctor-reviewed health videos that help you understand your body better every day. A urinary tract infection, or UTI, is an infection in any part of your urinary system: the kidneys, the ureters, the bladder, or the urethra. Most infections stay in the lower part, the bladder and urethra, but when they move upward toward the kidneys, the problem becomes far more serious. Women tend to get UTIs more often than men simply because of their anatomy. And when a UTI hits the bladder, it can feel painful, irritating, and endlessly frustrating. But here's the important part: it's treatable and even preventable when you understand what's happening inside your body. Now let's look at how a UTI feels: that burning sensation during urination, the constant nagging urge to pee, passing only tiny droplets each time. Sometimes the urine turns red, pink, or cola-colored, a sign of blood. Women often feel a dull ache in the pelvic area, and in older adults, symptoms may be so subtle they're mistaken for something else entirely. The symptoms depend on where the infection is. If it reaches the kidneys, you might feel pain in your back or side, have a high fever, chills, nausea, or even vomiting. If it stays in the bladder, you might notice pressure in your lower belly, painful urination, and blood in the urine. If it affects the urethra, burning and discharge become more common. So when should you see a doctor? The moment you notice these symptoms, because early treatment prevents bigger complications. Now let's talk about what actually causes a UTI. Your urinary system is designed to keep bacteria out, but sometimes defenses fail. The most common culprit is E. coli, bacteria that live in your gut but occasionally travel where they don't belong. Other infections can spread from sexually transmitted bacteria, especially in the urethra. Some people get UTIs again and again, known as recurrent infections. Women are especially at risk because of the shorter urethra, hormonal changes during menopause, and certain types of birth control, like diaphragms and spermicides. Other risk factors include low water intake, constipation, not fully emptying your bladder, urinary tract abnormalities from birth, kidney stones, a weak immune system, catheter use, or even recent urinary procedures. When UTIs are treated promptly, complications are rare, but if ignored, they can cause permanent kidney damage, early labor in pregnancy, narrowing of the urethra in men, or even sepsis, a life-threatening infection that spreads through the bloodstream. So, can you prevent UTIs? Yes, often you can. Drinking plenty of water helps flush bacteria out. Cranberry products may help some people, if your doctor approves. Avoiding deodorant sprays or harsh feminine products can reduce irritation. And if you use diaphragms, spermicides, or unlubricated condoms, it may help to switch to a different form of birth control. So here's the simple truth: a urinary tract infection begins when bacteria enter the urinary system and start causing irritation, burning, and frequent urges to pee. Most cases stay in the bladder, but if ignored, they can travel upward and become dangerous. Understanding the early signs, drinking enough fluids, and getting timely treatment can prevent pain, complications, and repeated infections. Your body always gives you clues, and listening to them is the first step toward healing. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, Medicine Specialist, Diabetes and Hormone Specialist. Information collected from Mayo Clinic, Cleveland Clinic, and NHS UK. If you found this video helpful, please subscribe and share it, because awareness is the first step to healing.